when we had these characteristics of the enemy, the Ebola, we decided that this time we shall fight differently. It's not necessary to have lockdowns, to close schools, to stop you from going to churches, to the markets, traveling. Now, there's also another characteristic which shapes our strategy. Because number one, I've told you, it doesn't go by air. It doesn't go through breathing. Number two, so it only infects by contact. But number two, even with contact, it cannot go through every part of the body. It goes only through a few areas of the body. The eyes, the mouth, the nose, the soft parts. Otherwise, here on the skin, it can stay there. And if I don't transfer it by touching and touching myself, it will stay there until it will not infect me. But there is another weakness on the side of the virus, number three, which shapes our strategy. This is that although it stays in the body for a number of days, I think it stays in the body for 21 days or something, somebody said, it can be there, but not showing itself. But apparently, before the virus starts showing signs, it's not infective. It only becomes infective once you start showing signs like temperature, vomiting, and all that. Oh, it is now those three things that shape our strategy. If it is not going through the air, if even when it gets on your skin, it doesn't infect you unless it goes through the soft parts of the body. If it doesn't infect until you start showing signs, and one of the signs is temperature, then it is easy to fight this enemy. That's why, therefore, we decided that we shall not have lockdowns. It's not necessary to have lockdowns. We just need to take care of a few things. So that's why, therefore, let me read what the ministry has prepared here, and then I would add on. I am here to talk to you about another disease outbreak in the country. While we are still battling COVID-19, the Minister of Health has informed me that we have cases of Ebola in the districts of Museveni, Chejegwa, and Kasanda. The initial case was a 24-year-old male from Ngabano village, Madudu sub-county Mubende district. This person was seen on the 15th of September, 2022 at Mubende Regional Referral Hospital. He was found to have signs and symptoms that included fever, diarrhea, vomiting, chest pain, pain in swallowing, and dry cough. He was isolated and given supportive treatment while investigations were going on. On the 17th September 2022, he developed yellowing and bleeding from the eyes. He also informed the healthcare workers that some people had died from his village with similar symptoms. This prompted the healthcare workers to take off blood for analysis for viral hemorrhagic fever, specifically Ebola, and dispatch a team to his village to verify the information. Unfortunately, we lost this man on the 19th of September 2022, the day that his sample was confirmed positive for Ebola. As of yesterday, 27th September 2022, there were 24 confirmed cases of Ebola virus and 5 deaths from the districts of Mubende, Kyejegwa, and Kasanda. And these were so 5 people are the ones who have died. You have been seeing in the press wonderful monitor newspaper, the one which works for the enemy. They have been proclaiming, I don't know how many have died, I don't know how many, but the people who have died here are 5. Now, the 24 confirmed cases. I don't know whether the 24 included the 5 who died or they included the 5. So 24 people confirmed, 5 of them dead. That means infected but not dead, 19. I'm sitting here with all the powerful people of the ministry. There's Dr. Jenna Cheng, there's Dr. Diana Twine, there's Dr. Mwewesa. From here you go to heaven. There's another place. But when you go from this, there's no other address. If you want health matters, there's no other place. Then I also have the Prime Minister here. I have Nankabirwa to support my Uganda, and I have my young sister, Joyce Sebugwao, and some other powerful persons whom I don't have to disturb you with. So the people, the cases, and these people I saw on the Al Jazeera, quoting wrong figures from Monitor. So the case is 24 confirmed, 5 dead. 6 health workers, 4 doctors, 1 anesthetist, and 1 medical student exposed to the index case. What is index case? The first one. Oh. Between 15th and 18th, have tested positive to Ebola and are being managed at Mbende and Fort Portal referral hospitals. They are being treated. That's what, you know, when I read the document of the Minister of Health, I must keep localizing their word. Management as if they are managing a bank. For us in our language, we say they are being treated. They are being treated. The table below shows a breakdown of confirmed cases and death by district and sub-county. I have them here. Mubende, Madudu sub-county, confirmed cases 11, dead 5. Mubende municipality cases 5, dead nobody. Kasambia 1, 0 death. Chiviringa 1, nobody died. Chitenga 1, nobody died. Then in Chejegwa, Kasule sub-county, 3 cases, nobody died. Kasanda sub-county, 2 cases, nobody died. So 24 people infected, 5 are the ones who are dead. In addition to the Ebola 5 confirmed deaths, there are 19 individuals who died in the community after showing similar signs. Since they died at home, we do not have opportunity to test them. I'm told that the current transmission in Madudu sub-county in Mbende district and in other districts appears to be driven by exposure at barriers and family interactions following the death of people suspected to have succumbed to Ebola. This is the first time in more than a decade that Uganda is reporting an outbreak of Sudan Ebola virus that last occurred in Nyimbwa sub-county, Ruwero district in 2012. The last Ebola outbreak in the country, which was in Kasese district, was of the Zaire strain and was imported from Congo in 2019. This outbreak was controlled without any community spread. Actually, this disease may not spread so much because the brief I read was that these first cases in Madudu were first reported on the 6th of August, 6th or something like that, or 5th, 6th. So this is more than a month ago, almost 2 months. And these people just kept quiet at home until this fellow who came to the hospital. So you can see it's not really that, it confirms Because this is 2 months. If it was our other problem, corona, I think we would be having bigger numbers. But this, the first case, no, is it the one who died? The first who died in the village, whom they kept quiet about? Jane, you explain that.
Those are the 19 whom we didn't test, who had signs and symptoms in the village, but we didn't confirm.
So those are the ones of the 6th?
Yes, from the 6th.
What is Ebola? Ebola is an acute disease caused by a virus and is deadly if left untreated, or if treatment is delayed. It is transmitted through contacts as follows: person-to-person transmission through contact with body fluids from an infected person, such as blood, saliva, sweat, urine, feces, sexual fluids, etc. Contact with objects that have been contaminated with body fluids like blood, feces, vomit from an Ebola-infected person, or a person who died from Ebola. Contact with secretions of infected animals such as fruit bats, chimpanzees, gorillas, monkeys. Eating meat from wild animals found dead or sick, especially monkeys, chimpanzees, gorillas. Those cultures of eating those same humans, because gorillas are like human beings. So why some people eat their relatives, I can't understand. I've got cows, some of our people have got goats. So people, muveko bazita batia?